Zach, tell us a little bit about the residential program and how it works.
Sure. So the Veterans Program is really designed in 3 phases over the 6 to 12 months. We run a red, white, and blue phase. The what I would consider to be the overarching theme of our program is really helping the veteran understand and experience recovery from PTSD, from substance use, from any other co-occurring that might have preceded or come from their military experience. So during that time, what we're doing is trying to really it's almost a replication of what happens during military training, which is considered to be like a crawl, walk, run experience. So in the red phase, we do a lot of work with the individuals on site. We make sure they get all their in-processing done, their paperwork, get them set up and identify what services they're going to need within our program and then possibly auxiliary to our program. But then we also allow them, that's their time to really understand the culture that we're creating in that program to begin to settle in and feel comfortable and acclimate to it. That's really where the connections start and really the purpose finding begins. Then when they feel as though they're able to advocate, they work themselves into a position where they actually advocate for themselves to get into the white phase of treatment. That's really the core. That's the intimate part of their treatment where they're going to start looking at and processing through their substance use experience or history, their military history, their relationship history. We have a family counselor on staff that will begin to work with them to start reconnecting themselves to their family. She'll do assessments and help them start identifying their role within a family, start reconciliation, start saying goodbye to some relationships that may not be healthy for them moving forward. And that's also the time when we really start having them begin to dictate what kind of purpose and direction they're looking for as they move into the blue phase. And again, there's an advocation process there that an individual has to work their way into standing in front of us as staff, or I should actually say sitting with us. Yeah. You know, it's a collective process. And during the blue phase, that's really the integration process there. That's when we sit down with the hero and we say, listen, let's look at your day. We've created a structured environment. We've created a schedule for you. Now let's scale that back and how about you create one? What time do you want to wake up? What time do you, are you going to get to your laundry? Are you going to get a part-time job? Are you going to look into going to North Country College like we talked about? And they really start to dictate their time and start to experience what life looks like on life's terms. You know, we do a lot of family sessions. We have 3-day family retreats. We just finished a couples retreat where the veteran can spend time with their significant other and really get intimate and talk about some of the hidden issues and things like that. So what we try and do has been observed here is that sense of purpose and trust needs to get rebuilt. And within 6 to 12 months with these phases, we allow the individual to really set their own pace and figure out who they are and how they fit into their family and community, and then guide them in directions that they're going to be successful.
How many vets do you treat and how successful have you been?
Currently we have 18 heroes in service right now that are receiving treatment. I think we've admitted, it's just about 80 to date in the less than 2 years we've been open. I know that we've had over 20 successful completions that range from staying with us from 6 months to 12, even 13 months if needed, to just make sure that their recovery plan is in order. But we've had individuals so far, they've engaged in North Country Community College. Like Bob mentioned, they're now finishing that up and they're working in their 4-year degree programs in different areas. We have individuals that have found employment and they've stayed in the area. And you know, we've had a lot of people that have left and gone back to families or home of records, and they do a great job of calling us and staying connected. And you know, we just got a call from an individual that actually went back to a treatment center, got employed as a residential aide there to give back in his own way, and said he's got 3 years clean as of this last weekend. So there's been a lot of success in the amount of time we've had.
If they relapse, can they come back?
They can't just come back. If they relapse while they're with us, one of the things that we do at St. Joseph's is we look at we look at recovery as a restorative process. And with that being said, that allows for life to happen. And every now and then that looks like relapse in some form or another. And the beauty of being able to work in the agency that we do with the population we do, we can sit down and say, listen, is this still the best level of care for you? Is this still the best environment for you? Do you want to stay here? And then we can work with the individual to update their treatment goals and really try and wrap ourselves around them so that we aren't engaging in any form of re-traumatization in the sense of you already feel as though you've engaged in some unhealthy behavior and we're going to reinforce it by having you go somewhere else.